This is the third fungal infection I've contracted in Thailand. It's quite tender, very ugly, but it's actually a lot less serious than the previous fungal infections I've had. Fungal infections can be quite a problem in Thailand. I got some medicine yesterday, so hopefully it'll be better within a week or so. And here's a comparison with my other thumb, just to show you the difference. Within a year of getting to Thailand, I almost lost my eye. I arrived wearing monthly disposable soft contact lenses, and one day I felt as if there was something in my eye, like a grain of sand or something. It was very uncomfortable. So I went to see a doctor who wasn't an eye doctor. He just assumed it was a bacterial infection and gave me antibiotics. After a few days, the antibiotics didn't do anything at all, so I went back. And then he thought to himself, well, it's not a bacterial infection, it must be a viral infection. So he gave me antiviral medicine. That didn't make any difference. So I was getting quite concerned, so I went to see a proper eye doctor. He wanted to do tests and he needed a sample. So he did a corneal scraping. He literally took a knife and scraped the top part of my cornea, which was quite an uncomfortable procedure. He diagnosed a fungal infection and gave me some very expensive medicine. And it also had a very short shelf life, so I buy this medicine and then after a couple of days need to throw it away, then buy some more. It was really expensive, but it cleared up the infection. But it left me with a scar on my cornea and affected my vision. After a few months, I went to the Ruptured Eye Hospital in Bangkok, which is Thailand's #1 eye hospital. And to fix the vision problem, they suggested a hard contact lens. And with a hard contact lens, it adjusts the shape of your eye. It brings the shape back. And that fixed the vision problem, but it was very uncomfortable. And because I got the initial problem through a contact lens, I didn't really want to wear another contact lens. So now I just put up with it. Before, I had short sight, so distance was a problem, but up close wasn't a problem. Now, even up close, the eyesight in this eye isn't good. But my brain has compensated for it, and I sort of get by, and I guess I'll just be like this for the rest of my life. And that was my first experience in Thailand of a fungal infection, and it really quite scared me. My second experience of a fungal infection was in my ear. It was August 2010. I remember the date because I had the problem during my wedding ceremony. My ear was constantly wet, and it was just spewing out loads of gunk, and this gunk had actually blocked my ear, so I lost the hearing on one side. And I went to see an ear doctor, and at first he suspected a bacterial infection, but antibiotics didn't do anything, so he gave me antifungal medicine, and that cleared the problem. It's quite a common problem in Thailand, fungal infections. There's not much you can do, so after showering, just make sure you're dry, use a talcum powder or medicated talcum powder. A few years ago, there was a Thai pop singer who drove his car into a canal in Bangkok, as you do, and the water was polluted and he contracted a fungal infection. I believe it got into his brain, and it made his brain swell, and eventually he died. So it can be really serious. So with this thumb problem, at first I was going to leave it, just see if it went away on its own, and it's just getting worse and worse. So last night I went to get some medicine. So if you do have a problem, just make sure you get it seen to fairly quickly. So what do you do if you have a medical problem in Thailand? When I was in the UK, there was a GP system, general practitioner, and everyone's assigned a GP, and if you have a problem, you go to your GP first. If he can't treat the problem, he'll refer you to someone else. In Thailand, that's not the case. There's no GP system, but there are actually lots of choices, and the first choice is to go to hospital. And when I first came here, that quite surprised me, because in the UK, hospitals are only for emergencies and for scheduled operations. In Thailand, it is quite acceptable to go to a hospital with a very minor problem. And there are private and public hospitals. And the private hospitals will only be too glad to see you. Primarily, they're businesses. They need to make profit. And foreigners are a good source of profit. So they'll be English-speaking members of staff to greet you and to take you through the whole process, and it will be really easy. But the private hospitals, especially some of the hospitals in Bangkok, can be very expensive if you haven't got insurance. You can also go to a public hospital, but the public hospitals are really intended for Thais. They're subsidised, and they don't really want foreigners taking advantage of their health system. If you go to a public hospital, which you're quite entitled to do, there won't be anyone to come and greet you. And if you're not with a Thai, and if you don't speak Thai, and if you don't read Thai, it's going to be quite difficult. But that is an option open to you. So the first option is just to go to a hospital. The second option is to go to a private clinic. Salaries in Thailand are abysmally low, and that includes doctors. So lots of doctors will open their own private clinic to supplement their wages. They'll go to their main job during the daytime, and in the evenings and weekends they'll work at their own clinic. That can be a bit inconvenient because if you want to go during the daytime, most of these clinics are closed. You can only go at weekends and evenings. But so you can see the same doctor for a lot cheaper. So that's another option. Where I live in Hat Yai, there are hundreds of these clinics. Now, that's the same in most parts of Thailand. There's lots and lots of private clinics. The third option is just to go to a pharmacy. The pharmaceutical degree in Thailand is 6 years, the same as a doctor. And the pharmacists are very well qualified. And they'll do a diagnosis and they'll prescribe you what you think you'll need. With the diagnosis, I don't think they're allowed to touch you. They won't check you like a doctor would at a clinic or a hospital. It's just done across the counter, and they'll ask you to describe symptoms. And if they think you need antibiotics, they can give you antibiotics, because in Thailand, antibiotics can be sold across the counter without a description. These guys are very good, and that's where I went yesterday. There are quite a few pharmacies around where I live, and one in particular, the girl is very good. I've got quite a lot of confidence in her. So I went to see her yesterday, and she gave me some oral and topical medicine. Nearly said something else then. And I'm hoping that will do the trick, and my thumb will be back to normal in a few days' time. So there are the options that you have in Thailand if you have a medical problem. If you're not familiar with the healthcare system in Thailand, I hope that at least a small part of that was useful. If you have any feedback, any questions or any other comments, please leave them below, and there will be more videos soon. Thanks for watching.